morning, everyone. Bienvenue à tous. Thank you for being here. Merci pour être ici. So my name is Dr. Yves Leger. I'm the province's Chief Medical Officer of Health. I'm here today to provide you with information on the investigation into cases of undiagnosed neurological illness in the province that's being led by my office in support of or with the Vitalité Health Network, as well as the Public Health Agency of Canada. Donc, je suis ici aujourd'hui pour vous donner une mise à jour sur l'investigation des cas de maladies neurologiques non diagnostiquées qui est investiguée par mon bureau avec le support du réseau de santé Vitalité et l'Agence de la santé publique du Canada. We invited our colleagues from the Public Health Agency of Canada to join us today so that they could speak specifically to their collaboration and support that they've been providing us on this file. They were certainly very eager to be here today as well to speak to that. But since the federal election has been announced and the government's now in caretaker mode, unfortunately, they are unable to join us today. Nous avons invité nos collègues de l'Agence de la santé publique du Canada à nous joindre ici aujourd'hui afin d'expliquer eux-mêmes leur rôle et leur contribution à cette investigation. Donc, ils étaient très heureux de le faire, mais puisque le gouvernement fédéral est maintenant en mode d'élection, ils ne sont malheureusement pas capables de se joindre à nous aujourd'hui. I know many New Brunswickers, including affected patients and their families, are concerned about this issue, and so are we, which is why I'd like to cover a number of aspects with you today on the work that we've been working on or conducting. In today's update, I'd like to give you a bit of history on the file in terms of what we've done to date, give you an overview of the work that's been going on this investigation, outline the next steps that we are going to be taking in this investigation, as well as outline some of the timelines as well, and when you can expect to receive further updates. Je comprends que plusieurs Néo-Brunswickois, incluant les familles affectées et les patients, sont inquiets et on l'est aussi. C'est pourquoi j'aimerais couvrir plusieurs aspects de notre investigation avec vous aujourd'hui. En particulier, je vais vous donner un peu d'historique sur ce dossier, couvrir les étapes de l'investigation qu'on a entamées à date, parler un peu d'où on est rendu sur ce dossier et puis vous donner un aperçu des prochaines étapes à venir, ainsi que les délais par rapport à ces étapes-là et quand vous pouvez vous attendre d'avoir des mises à jour. Our investigation into cases of undiagnosed neurological illness in New Brunswick started back in 2021 when Public Health studied a group of 48 patients with undiagnosed neurological illness. At that time, we put in place what we called an oversight committee, which was essentially a group of 6 specialists, a group of practicing neurologists in New Brunswick, who were tasked with reviewing the clinical files and details on these patients. They provided their professional advice and recommendations to each of these patients' physicians on further investigations that may be required. Once they'd reviewed all the patient files, they also weighed in on whether or not they felt that these patients or a subgroup of these patients might be suffering from some sort of common illness or a similar disease. And in their professional opinion, they didn't feel that that was the case here. À ce moment-là, on a mis en place un comité de surveillance, donc un comité qui était composé de 6 spécialistes, donc 6 neurologues pratiquants ici au Nouveau-Brunswick, qui ont été demandés de revoir les dossiers cliniques des patients. Ils étaient demandés de donner leur avis professionnel et leurs recommandations pour chacun de ces patients-là à leur médecin par rapport à des investigations additionnelles qui seraient nécessaires. Puis une fois les dossiers revus, de se pencher sur la possibilité d'une maladie inconnue, une condition commune à tous les patients. Et dans leur opinion professionnelle, ils n'avaient pas d'évidence pour suggérer la présence d'une telle condition. Now, if this group felt that these patients were suffering from a common illness, then that would have triggered further work and efforts to understand what that might be and what the cause of that illness might be as well. We would have brought together various experts from different fields of expertise to explore potential causes. We would have also sought further resources and further funding to support additional investigations and research to explore those causes further. Given the findings from this expert panel that did not suggest a common illness was present, that follow-up work was not justified at that time, and the investigation concluded in 2022. Now jumping ahead to early 2023, the same physician who reported on those initial 48 cases reached out to us to bring forward new concerns to our attention with respect to some of his patients. He had actual test results suggesting elevated levels on some environmental substances, more specifically heavy metals and pesticides. At that point in time, he also indicated he had 147 patients that were under investigation. He reached out to us to help him understand what was happening with these patients. Given the concerns he raised, which were also concerning to us as well, we certainly agreed to do that. It was with that in mind that we defined the main purpose of our investigation and objectives that we embarked on in 2023, which was to further understand the concerns brought forward by the physician with respect to certain environmental factors. Si on remonte au début 2023, le même médecin qui nous a rapporté les premiers 48 patients nous a rejoints à nouveau afin de nous partager ses inquiétudes par rapport à certains de ses patients. Il avait en main des résultats d'analyse qui suggéraient des niveaux élevés de certaines substances environnementales, notamment certains métaux lourds et des pesticides. Il nous a informé aussi que le nombre de patients qui investiguaient avait monté à 147. Il nous a rejoints afin de nous demander de l'aide à comprendre ce qui se passait chez ces patients. Il était inquiet par rapport à ces trouvailles qui nous inquiétaient aussi. Et on était donc d'accord de supporter notre travail. Là. C'est donc avec ça en tête qu'on a établi l'objectif principal de notre investigation qui a été entamée en début 2023, qui était de comprendre les inquiétudes qui ont été soulevées par le clinicien par rapport à certaines substances environnementales. Now, for us to be able to help him understand what's happening with these patients, we need data. We need information. To help us define and collect the information we would need, to help answer those questions, we prepared what we called an enhanced surveillance form back in early 2023. This two-page form was meant to focus the information that was crucial for public health to review, to be able to help better understand what was happening and be able to provide him and his patients with answers. Now, these enhanced surveillance forms are not necessarily new to public health. These are tools that many jurisdictions across Canada and elsewhere use on occasion when we need to collect additional information on an issue that's of concern. Sometimes they're completed by physicians, sometimes they're completed by public health staff, and sometimes by both. This form was finalized and shared back with the physician in May of 2023, and he's worked on getting some of those forms completed and sent back to us since then. Now, during the summer months of 2023, the physician did indicate to us that this was a lot of work to complete, especially since he had over 200 patients that he wanted to report to us at that time. We agreed with him and decided that we would provide him with support to work on the backlog of patients that he wanted to report back to us. And so since that time, we've been working to complete the collection of this information so that we can better understand what's happening and help provide him and his patients with answers. More specifically, we've completed the following activities to date. We started by what we call a scoping exercise back in late summer of 2023. This is really meant to help us understand the type of information that's being collected on patients, the format, and how it's collected. This helps us plan for how we can go in and collect the actual information in an efficient and complete manner. Once the scoping exercise was done, additional work was completed to take paper-based files and put them in a digital format and prepare them for extraction. That work was completed in the fall and winter of 2023. Then we went back to his office to complete the actual extraction of the data and place it in a database. That work occurred in March and April of last year. This support has also involved staff going directly to his office on numerous occasions to complete these activities. Since completing those last steps I've just mentioned, what we've done is we've prepared and put together the data we've collected into packages. We then provided these packages to the reporting physician for his review and sign-off. Those were provided to him in May of last year, and we've been working with the physician along with his employer, the Vitality Health Network, to support him in completing this task since then. So as you can see, there are a number of different steps that have been involved in completing this work. Having said all this, I do want to highlight that we've not been doing the work alone, far from it. We've received tremendous support from both the Vitality Health Network as well as the Public Health Agency of Canada to get to where we are today. Both agencies have provided innumerable support since the early days of this investigation back in 2023. They provided dedicated resources and expertise to help us in completing each and every step that I've outlined before. I'm hugely appreciative of the support and collaboration that we've received from these two agencies. Now, some have asked us, so why haven't we just gone ahead and just done the analysis at that point in May of last year with the information we collected to date? And so I'd like to just spend a minute to explain why we did this. So the physician raised concerns to us, concerns that we felt were important and needed to be explored. He asked for our assistance in understanding the significance of the findings, and we agreed to help him in collecting the information we thought was important to do that work. But before proceeding with the analysis, we need to make sure that the data is as complete and accurate as possible. This is not just a paper exercise. As scientists, we owe it to ourselves, to our patients, and to the physician to make sure that the data is as complete as possible so that the findings from the analysis can be relied upon. So it remained important to us that he reviewed the data to make sure that it was as complete and comprehensive as possible so that we would all have confidence in the results from this work. Having said that, today I'm happy to be announcing a few important updates to this work. Recent efforts have led us to receive a significant number of completed and verified patient packages. We now have completed and signed patient packages on 222 individual patients in hand, which we feel is enough to start the data analysis. I'm therefore glad to say that that activity is now underway with the support of the Public Health Agency of Canada. We expect that the data analysis phase should be completed in late April of this year. Also, a dedicated web page that's specific to this investigation should be coming live shortly. That web page will provide additional information on the objectives of the investigation, the work that we've done to date, where we're at, as well as next steps, including timelines around that work. I would encourage you to check regularly on that website for information and updates. On a complété plusieurs étapes depuis le début de l'investigation afin d'assister le clinicien à recueillir les données nécessaires afin de mieux comprendre les inquiétudes qu'il a soulevées. Aujourd'hui, je suis fier de pouvoir annoncer quelques mises à jour importantes sur cette investigation. Les efforts récents nous ont menés à recevoir plusieurs dossiers patients complets et vérifiés. On a donc en main maintenant des dossiers complets et vérifiés sur 222 patients. On pense donc avoir assez de données afin d'entamer la phase d'analyse. Je suis donc fier d'indiquer que cette activité est en cours maintenant avec l'assistance de l'Agence de la santé publique du Canada. On s'attend que la phase d'analyse devrait se compléter vers la fin d'avril. Now that we've undertaken the data analysis phase of our investigation, I'd also like to outline the next steps in our investigation with some estimated timelines around that work. As I mentioned previously, we expect that the data analysis phase will wrap up in late April of this year. We'll update you once the data analysis phase is completed and we're moving into the next phase of the investigation. And we plan to do that by providing an update on our website dedicated to this investigation, as well as issuing a news release to let you know that we've reached that step. The next step after the data analysis will be the interpretation and scientific review phase. And we'll do two things at the same time. We'll send the findings from the data analysis to the Public Health Agency of Canada so that they can do their own scientific review of the findings. Internally here, we'll also start to interpret the findings from the analysis and start to think about any recommendations and next steps. We plan for the interpretation and scientific review phase to be finished by the end of May of this year. And again, we will update our website and issue a news release to let you know that we've reached that step. Once we've received FACT's review of the findings and their interpretation, we'll be able to combine our interpretation along with theirs into a report on the investigation. We plan to have this work completed and ready to share with you all later this summer. At that point, we'll update you several different ways. We'll issue a news release, as well as providing a briefing similar to this one as well, to share the findings, recommendations, and next steps. We'll also issue a public report on the work and the findings, as well as update the website. J'aimerais aussi clarifier nos prochaines étapes à ce point-ci. Comme mentionné plus tôt, la fin de l'analyse devrait se terminer en avril de cette année. On vous informera par la suite la fin de cette phase de notre investigation par l'entremise d'un communiqué de presse et une mise à jour du site Web. La prochaine étape sera l'interprétation et la revue scientifique, où on fera 2 activités en parallèle ou en même temps. On va envoyer nos trouvailles pour une revue scientifique à l'Agence de la santé publique du Canada. Et puis à l'interne, on va nous aussi revoir nos trouvailles et commencer à interpréter ces données-là afin de formuler des recommandations et prochaines étapes. On vous partagera la fin de cette phase par un communiqué de presse et puis une mise à jour de notre site Web. Une fois qu'on aura reçu la revue de l'Agence de la santé publique du Canada, on va combiner tout ça avec notre interprétation et recommandation dans un rapport qui couvre l'investigation au complet. On vous mettra à jour rendu à cette étape-là par plusieurs différents moyens, donc un communiqué de presse et puis une mise à jour de notre site Web. On lancera notre rapport de façon publique et puis on fera un communiqué de presse ou un point de presse, je devrais surtout dire, comme on le fait aujourd'hui. Now, I hope that I've been able to clarify many questions that some of you have had on the work that we've committed to. Even though this work has taken much longer than we anticipated when we started this investigation, we certainly remain committed to completing it and to consider what else needs to be done to help patients and their families. Before closing off, I do want to acknowledge that this situation has surely been difficult for many patients and their families. If you feel you need support at any time, day or night, our provincial mental health line is here for you. You can speak with a trained clinician who can provide you with support as well as guide you to available resources you have in your community. They can be reached at 1-866-355-5550. Avant de terminer, je veux reconnaître que cette situation a sûrement été difficile pour plusieurs patients et leurs familles. Si vous pensez pouvoir bénéficier de support à n'importe quel moment, jour ou nuit, notre ligne provinciale de santé mentale est là pour vous. Vous pouvez parler à un clinicien formé qui peut vous fournir du support et vous diriger vers les ressources qui sont disponibles dans votre communauté. On peut les rejoindre au 1-866-355-5550. Merci beaucoup. Thank you very much